Welcome back to Eye on Cancer. I'm Linda Cass, and I'm here with, again, Pahrumph's only medical oncologist, the very smart Dr. Raja Mehdi, with answers that are clearing things up for me. You know, we've been talking about how cancer affects just about everyone, and so the question has arisen: what common types of cancer can we, this is a difficult question. What are the common types of cancer? What are the signs and the symptoms?
The top 5 would be, for men and women, prostate for men and breast for women. And then after that comes lung, colon, bladder, again for men, and uterine cancer for women, melanomas and lymphomas. See if you want to cover both sides. By far, the most mortality we get is from lung cancer. Thanks to the screening, breast cancer is picked up earlier now. And we see a much improvement in the survival rates, and most survivors are in that category. And prostate cancer, we diagnose a lot of men, but not everybody needs treatment. So I think that's an important one also to know. Lung cancer, I believe, because it's such a mix of different disease processes, that the progress in improving survival has been relatively low. And also that's, because, smoking is such a big contributor to that. In terms of the signs and symptoms and what to watch for breast cancer, mammogram screening, I would say definitely we should do. The other important concept about breast cancer, or for any cancer, is that if I don't have it in my family, I don't need the screening because I won't get it. Less than 10% of these cancers are genetically linked.
Wow.
Overwhelming majority of the cancers arise in patients with no identifiable family history. So it's very important that everybody benefits from screening. You don't have to have a family history for that. So mammogram screening is one, then breast self-exam is another one. So if you feel a skin change in the breast, nipple discharge, nodularity, don't ignore it. Exactly. It needs to be evaluated by your provider right away. Those would be the early signs. For prostate cancer, the typical symptoms would be the hesitancy or urgency in the urine.
Okay.
And also that needs to be evaluated. Lung cancer, the signs, the early signs would be cough, which does not go away. You could have blood in the sputum. And a general sign of cancer that's applicable to all of the cancers is weight loss.
Okay.
Unintentional weight loss.
Right.
Low-grade fever that's unexplained by any infection. Lack of appetite. Pain that is in one spot and reproducible. Meaning it's not like I hurt somewhere today and somewhere else tomorrow. If you're hurting in one specific spot, that could be a very, very, very specific sign of cancer. Unfortunately, that would generally be cancer spread to the bone, so it wouldn't be catching it early. But still, those would be the things that you would pick up.
Wow, that's are cancer signs easy to detect, or can they kind of hide a little bit?
I think they can hide. When the patients come to me, it's relatively, because I'm so focused, and they have been screened by the primary care doctors, is that it's easy for me to pick up, but it's very easy for primary care provider to overlook it. And I can see, myself, when you come in and you have, 10 or 12 medication that you have to go through, and then, you just casually mention a symptom. So they can certainly hide. On the one of the things about lung cancer is that for the longest time, the screening methods did not really pan out. They've tried CT scans and chest X-rays. Lately, we may be allowed to screen high-risk patients, active smokers in certain age range, with once-a-year low-dose CT scans. So we'll see how it pans out, but it has shown to be beneficial in recent research.
Wow. I've always said it. Cancer is an insidious, evil disease. And, there really is a reason for people to be afraid of it, because it's, it's not the easiest one to detect for your general practitioner. And, but over the years, are you seeing better response, better drugs, better, just an improvement in the industry?
Yes, I do believe that, we could use a little more focus on prevention rather than treating it later. So that part, I definitely feel can use some help in terms of funding. In terms of research and finding new drugs, I like the shift from treating cancer in general with chemotherapy or, towards more targeted drugs to each cancer.
Wow. So much information you've given us today. I think we need to come back.
Absolutely.
Okay, so this is it for today. Eye on Cancer, EOC@kpvm.tv for your questions, and you can also call. This is not a live show. Thank you so much, Dr. Mehdi, and thank you.
Thank you.